Hello, I'm Dr. Wendy Burton and I'm a general practitioner here in Brisbane, Australia, and I'd like to introduce you to my colleague, Dr. Paul Bretz, who's the Director of Obstetrics and Gynecology at the Mater Mothers Hospital in Brisbane. And we'd just like to have a quick chat today to pregnant women about some of the changes that are going to be occurring in antenatal care as a result of the COVID-19 situation. So first and foremost, we want to point out that you're very valuable to us, and that along with other groups such as the elderly and people with diabetes, high blood pressure and such, you do fall into a vulnerable category. Not because COVID-19 is any more or less severe in pregnancy, but also because it's not just you. There's baby or babies for us to consider, and it's very important to us personally that we keep you as safe as possible, but that will mean that your care is going to change somewhat. Paul, what did you know on an international basis? Why is this important?
It's been recognised that overseas there have been women that have caught COVID-19 through attending antenatal appointments, and whilst in some cases they're unavoidable, in many cases the information that's relayed and transferred doesn't have to be face-to-face, and telehealth is emerging as a really suitable way to conduct the majority of antenatal appointments, Wendy.
Okay, so this goes back to the whole concept of staying at home and sheltering in place, keeping yourself safe, the whole physical spacing so that you reduce the chances that you'll pick something up from someone, washing our hands, staying away from sick people, all these important factors. Well, hospitals and antenatal clinics are one of those spaces that we really don't want you in unless you absolutely need to be there. But we have other alternatives. So it's not that your antenatal care will stop, but it will look different and feel a little bit different. We'll be doing way more by telehealth. And then when you do have some face-to-face contact, that's likely to be short, sharp and focused, because for your protection and for our protection, we will want to keep those interactions below the 15-minute mark, which is the definition for close contact.
I thought I might add, Wendy, that another thing that will change, of course, is access to tours of maternity facilities and to face-to-face antenatal education. But of course, there's online tools that are well developed and available through your maternity carer, and there's a wealth of good evidence-based material that you can access online.
So fortunately, we do have internet options, and we definitely want you to continue to get the advice and information you need. Unfortunately, COVID-19 is changing our world, and a little bit like our year 12s and folk who are planning to get married this year, your journey is going to be a little bit different. It will still be special, but it's very important to us that it's also safe. So blood tests will continue. There may be some changes in what we do. Scans will continue. There may be some changes in what we do, but nothing concrete at this point in time. We'll need to stay agile, and you'll need to stay tuned into what your local service or provider is recommending.
Please be assured that when the time comes to come up to the hospital to have your baby, we've been planning and are confident that we're going to have your safety front of mind. We have systems now well developed to look after pregnant women as they transit through the hospital, and when care at the hospital is required, it's going to be of the same standard it always has been.
So please be reassured that Australia continues to have a high standard of antenatal care, and that your birthing experience and your postnatal journey, we will make it as good as we possibly can. It will look and feel a little bit different at the moment, but Australia, we've got this. So stay safe, and we'll see you on the other side. Thank you.